Hi, I'm Michelle Ostrelich, a Schenectady County Legislator and Chair of the Health and Human Services Committee. I'm here today with Lisa Ayres, the Director of Public Health, to talk to you about how to keep you and your loved ones safe, the best guidance to date that we have, and also any resources that you may need to rely on. So, Ms. Ayres, can you please talk to us about what recommendations from public health we're seeing right now?
I'd be happy to. Thank you for asking that. That's a really great question. And I think that what we can do to ensure that all of our loved ones in our community is safe is to continue maintaining physical or social distancing. We have been doing that for quite some time now, and I know it's very challenging, but it's working. We have seen our curve, as you've heard, the flattening of the curve. What does that mean? Flattening of the curve means that over a span of time, how many individuals get sick at one time. And in our community, because we started containment and mitigation and social distancing so early on, that we have not seen that sharp curve, which means that we are not overwhelming our healthcare system. We have plenty of ICU beds available, we have plenty of hospital beds, we have plenty of healthcare workers to ensure that everyone receives care if they so should need it. So I think that's the message. We have to stay on course. It's challenging, but it's working, and I really feel very happy with our community and the efforts that we've done to maintain this. Each and every one of us has a responsibility to protect everyone by keeping that 6-foot distance, staying home, limiting going out. If you do go out in public, and you have to go out in public, it's very important now to wear a cloth face covering. That could be made with any material from your home, and that will protect you. So if you have symptoms, you're not going to spread it to anybody and still maintain 6 feet distance, even with a cloth face covering on.
Thank you very much for those personal recommendations as everybody tries their hardest. And for all of your efforts, can you give us a behind the scenes? What's going on at the Department of Health? What happens when you get a call on your end?
We in public health do a very good job at emergency preparedness. We're trained, we're public health professionals. When we were studying this virus early on, we knew that we had to take this really seriously, looking at other countries. We began preparing for this in early January, looking at our inventory, getting our personal protective equipment ordered and on stock. We developed all of our plans, made sure that they were up to date. We had all of our isolation quarantine orders reviewed by our law attorneys. And so when it started to enter into our community, we were ready and we were prepared. We have a wonderful group of professionals for public health, as well as volunteers and paid staff that are helping us with our efforts. And our volunteers consist of nurse practitioners, physicians, retired nurses, furloughed nurses, and our own public health staff. And we are working diligently to do contact tracing. Anybody who's been in contact with an individual that may have had the infection, we contact everybody. We identify who's had that close contact. We give direction for that individual, how to stay safe, how to stay home, what symptoms to watch for, and what to do if you get those symptoms. We have a call center that receives calls from physicians' offices, from the general public every day. When an individual is on quarantine, that's an individual who is exposed but well. Or an individual who's isolated, that's an individual who is not well, who is exhibiting symptoms. We follow those individuals. We place a phone call to them. We do home well checks if we need home well checks done on those individuals. We provide basic care for them, a thermometer so they can monitor their temperature. So we are in very close contact with all of our individuals and assessing for any needs that they may have versus medical or non-medical needs.
So from the perspective of a resident, what should they do if they think they've come in contact with someone who's been positive, or they feel like they might have had symptoms? I know it's hard right now during the season of allergies. We've all got sniffles and sneezes. And can you talk about what the symptoms are?
Sure.
And what they should do from start to finish and what they can expect from your department?
I think it's a great question, and I think with this virus, we've seen a variety of symptoms, and we do know that you can be asymptomatic and still be infectious. So the most common symptoms are respiratory symptoms, cough, fever, shortness of breath, difficulty breathing. If you have any symptoms, our recommendation is always stay at home, call your healthcare provider. If you feel that you need emergency care when you're calling 911, identify with them what's going on so they can use the protection that they need so they do not become infected with this virus. And then depending on what the symptoms are, that would be called into public health to follow these individuals, whether they need testing, whether they're just mildly ill and need to stay at home for it to run its course. Because the majority of individuals that do get infected with the coronavirus, it's very mild illness. It's an illness that an individual can stay at home, just like a cold symptom with a little fever.
Do people need to call their primary care physician as well as public health, or does that happen automatically?
If an individual is ill, you should always call your healthcare provider. We are not physicians. We are public health professionals, so always call your healthcare provider, and we can always be called at the health department as well. And I would like an individual to call us as well if they're having symptoms or feel that they've been exposed, because that's very important for us to follow those individuals to ensure safety.
Great. And if a test were to be taken on an individual and it came back positive, would they need to call you, or would that happen automatically?
That usually happens automatically. We have a great surveillance system currently in the state of New York. All positive and negative coronavirus tests get loaded to us as soon as their results are. They get sent to us on an electronic database. We have a staff that takes those lab reports off continuously through the day. Every morning they're on the system. And then it begins. Anybody who's positive, we're going to contact that physician, find out a little bit reasons why they were tested, and then we call that individual and try to determine anybody that they had close contact with when they were experiencing those symptoms, so we can notify those individuals and keep them safe and alert them that they may have had an exposure and what symptoms they need to watch for and when to call the doctor and when to call public health. So we will follow those individuals.
Got it. Early on, there was a problem with having enough test kits nationwide and certainly in Schenectady County as well. And we're looking at some news stories that are coming out that even now there are some elements of the test kits that are going to be scarce. How prevalent is testing available right now, and what are the criteria required or thought to be needed to qualify for a test?
That's a great question. We have been struggling in this area to get adequate testing available. So our population, a lot of our population has not been tested. And the recommendations change as it gets lifted, and I think in the near future we're going to have availability of test kits. We do have Ellis Medicine as test kits available for their clients and patients. Community Care, Capital Care has test kits available. They must call their physician first and arrange, and that physician will determine the symptoms for availability of testing. There is a drive-through testing facility at University of Albany that's available for the whole capital region that has to be arranged to their physician. So they must call the physician, tell their physician the symptoms they're experiencing, and they will set up an appointment for them to drive through and get testing. Public Health is diligently looking to expand testing in our region. We have put an order in for our assets, and we are diligently studying all the new testing and methodologies that's out there. We have a team of physicians who are studying these test kits that are available to make sure they're reliable, because we want a good test kit.
What indicators are you looking for that might seem that we can start to relax our safety precautions and get back to normal?
That's a really good question, and it's one that we're studying every day. I know that we've done a really good job at flattening the curve by doing all the measures on staying home, social physical distancing, if you're ill, separating yourself from your loved ones and friends, not participating in mass gatherings, even if they're in your own home. So we got to continue that, and we have to watch that. Every day we're still getting new positive tests. Every day, hopefully we do not have deaths, but we have had, not a lot, but we have had some deaths. Until we can study that and watch that, that's starting to slow down. So we're anxiously following the governor's direction on that. We're studying it through the state, and time will tell when we can relax it. But at this point, we have to stay on course. Very important, because what we're doing is working.
The losses of life have been really heartbreaking, but your words are really heartening. So thank you so much. Is there anything else you'd like to add?
I think the most important thing is we're doing a great job. Stay on course and follow the directions of social distancing, physical distancing, and when ill, calling your physician and assessing if there's a test kit available.
Thank you, Director Ayres. And I do want to thank you and your incredible department. The amount of work that you've had to do this past month or so, actually, since you mentioned since January that you've been on it, and how much your department has expanded to take on all that's needed in this emergency. I can't thank you enough. And Schenectady County is so appreciative of the way that we've been able to keep our folks safe. And thank you to all the medical providers and first responders as well. So thank you.
Thank you so much for having the opportunity to discuss this important issue with you.